fucking hoes and popping pillies, man, I feel just like a rock star.
Future doctors, and welcome. Today, we're going to tackle a topic that is, and I really mean this, the absolute cornerstone of all physiology and medicine. We're talking about homeostasis. It's this incredibly complex, behind-the-scenes dance of millions of processes that are all working to keep you alive, and it all centers on one simple principle: balance. You know, understanding this is the absolute key to unlocking the mysteries of both health and disease. I mean, just think about it for a second. Your body automatically starts sweating when it's hot and starts shivering when it's cold. Your blood sugar somehow manages to stabilize after a big meal, stopping a dangerous spike. So what's in charge of all this? It's not some little manager sitting in your brain, but an incredibly intelligent, fully automated system. And today, we're going to explore that system, this constant, life-sustaining battle for internal balance. Okay, let's get into it. So what is homeostasis exactly? Well, here's the textbook definition for you. It's the body's ability to maintain a relatively stable internal environment, no matter what's going on outside. Now, pay close attention to that phrase, relatively stable. This isn't some rigid, unchanging state. It's dynamic. It's a constant series of tiny adjustments to keep everything within a very narrow optimal range. Really, you can think of it as your body's own internal thermostat, just tirelessly working to keep everything, your temperature, your blood pressure, your oxygen levels, exactly right. So, how does the body pull off this incredible feat of balance? Well, its main tool, the most common strategy it uses, is a kind of counterattack. It's a mechanism we call negative feedback. The vast majority of your body's homeostatic control systems are negative feedback loops, so it is absolutely crucial that you master this concept. Let's break that down. The most important thing to get here is that this mechanism opposes or negates the original change. It's a counter response. So if a variable, let's say your body temperature, starts to climb too high, the system kicks in to bring it back down. Or if your blood sugar drops too low, it works to bring it back up. It always works in the opposite direction of whatever the stimulus was, and the whole goal is just to restore that balance. This right here is a perfect illustration of the 5 parts of any feedback loop. Let's trace the path together. First, you've got the stimulus. In this case, it's the cold. Then, sensors in your skin detect that change and send what we call afferent signals. Here's a tip for your exams. Remember A for arriving. These signals are arriving at the control center. The control center, which is the hypothalamus in your brain, processes this info and sends out efferent signals. Think E for exiting. These signals exit the control center and go to the effectors, your muscles and blood vessels. And what do? They carry out the response. Blood vessels get tighter to save heat and your muscles shiver to make more heat. This response directly counteracts that initial cold stimulus, bringing your body temperature right back up to normal. Just burn this simple phrase into your memory. The goal is to counteract. It doesn't matter if we're talking about body temperature, blood glucose, blood pressure, or blood pH. The vast majority of our physiological systems are built on this one fundamental principle. The system finds a problem, a deviation from normal, and it starts a response to bring it back. That right there is the very definition of stability in physiology. Okay, but what if the body doesn't want to counteract a change? What if, for some specific reason, it needs to go all in and actually amplify a response to get a really fast, powerful result? Well, that's where a much rarer but incredibly potent mechanism comes into play: positive feedback. Now, this is the total opposite of negative feedback. Instead of dampening the stimulus, this system reinforces it, making it stronger and stronger and stronger. So instead of a thermostat that shuts off when things are back to normal, I want you to think of this as an avalanche. A little bit of snow moves, which triggers a bigger movement, which triggers an even bigger one, until you have this massive, unstoppable event. This system is designed to take a process all the way to completion. And childbirth is the classic textbook example. As you can see here, the initial stimulus is the baby's head stretching the cervix. This sends signals up to the brain to release a hormone called oxytocin. Oxytocin then travels to the uterus and causes contractions. This pushes the baby's head even harder against the cervix, which increases the stretch, which signals for even more oxytocin, which then causes even stronger contractions. Do you see the loop? It's this explosive, self-amplifying cycle that only stops when the final goal is met. The baby is delivered, and that removes the initial stimulus. Okay, now this table is pure gold for your exams. It's a perfect summary that contrasts the two mechanisms. So let's just quickly run through the key differences. First, the goal. Negative feedback is all about counteracting, while positive feedback wants to amplify. The outcome. Negative feedback promotes stability, that's what it's for, while positive feedback promotes rapid, explosive change. Prevalence. Negative feedback is the body's go-to system. It is everywhere. Positive feedback is rare, it's saved for very specific, short-term events. And finally, you've got your classic examples to remember. All right, so we've looked at how these systems work perfectly in a healthy person. But why is it so important for you, as a future doctor, to really master this concept? Well, it's because almost every single disease, every patient complaint you will ever see can be traced back to a failure in homeostasis. This is it. This is probably the most important clinical takeaway from this entire lecture. The breakdown of a homeostatic mechanism is pathophysiology. You see, disease isn't some strange external force. At its very core, it's just the body's inability to maintain its internal balance. Understanding normal physiology is the absolute non-negotiable prerequisite to understanding what goes wrong in disease. So let's look at these clinical conditions through this lens of homeostasis. Take diabetes mellitus. That's a broken negative feedback loop. The body can't use insulin to lower blood glucose. The result? Chronically high sugar that damages everything. Or think about severe hyperthermia, heat stroke. The body's cooling systems just get overwhelmed and fail, leading to a dangerous spike in core temperature. In circulatory shock, the systems that maintain blood pressure fail, starving the tissues of oxygen. And hypertension? That's a failure of the feedback loops that should lower blood pressure, leading to sustained high pressure that wrecks arteries and organs. Every single one of these is a direct result of a specific homeostatic failure. And really, this brings us to the central question for anyone going into medicine. This isn't just a hypothetical question. It is the absolute essence of what you will do. A physician's entire job is to figure out precisely which homeostatic mechanism has failed, and then use every tool you have to help the patient's body restore that delicate balance. The entire practice of medicine is built on this foundation, understanding and correcting these imbalances.